start off with a little bit of lighthearted humor to kind of introduce this topic. Okay?
I'm feeling good. I actually just recently had to go to the emergency room, though, and I had some stomach virus thing. I almost called an ambulance. It's weird, even considering calling an ambulance for yourself. You know? You call ambulances for other people, right? What are you supposed to say about yourself? Can you come get me? Yeah, I don't feel so good. Just come on and I'll be lying on the floor. Just looking at the phone going, I don't know how to do this. I don't know what to do. It was at night, so I drove myself to the emergency room. That's a nice relaxing drive. No, after you. Merge, everybody, merge. I'm only imploding. So I pull up at the entrance to the emergency room. No valet parking. I mean, that's not the biggest oversight in our solar system. If there's ever a time where you want to go, can you park this because I need to collapse immediately? No, I'm circling around the parking lot. Can I park there? I think I'm going to die. I'm dying too. Okay, go ahead. I'll go up a couple levels. I go in to check in. They ask the most insulting question when you check into a hospital. What seems to be the problem? What seems? Well, it seems. It seems like everything on my inside wants to be on my outside. But I'm no doctor. What kind of condescending question? So they check me into my luxurious half room. There's a curtain down the middle with a mystery patient on the other side. And he's moaning over there. Man, they're never going to help me with him moaning like that. So I got to out-moan him, you know? Quit moaning, we're all hurting. The whole floor is like a hunt.
All right. Has anybody here gone to the ER? Oh, wow, a lot of you. Well, I'm an emergency physician. I work at the Banner Bailey Medical Center. I've been an ER doctor for 22 years. So what are we going to talk about today? Thank you, Ron and Dr. Coop, for inviting me, by the way. But what are we going to talk about today? We're going to talk about what is an emergency physician. What do I do? What am I? Why would you want to be an ER doctor? And how do you become one if you decided you want to be an emergency physician? So what is an emergency physician?
What is it?
Explosion at a power substation. Multiple burn and blast victims 3 minutes out.
How many?
At least 8.
Make sure you clear the shower rooms, care get the blood bank to send all their own eggs. Dawn, make sure we have enough morphine around confusers.
ERA. You want to be an ER doc? This is the fun part.
Morris, triage. 55-year-old man thrown 20 feet against the wall. Confused abdominal pain, BP 80 pounds.
Rigid abdomen, probably spleen or liver. Tracy, do a bone egg and hold for the OR.
All the fever good distal pulses.
Now take this. Julie, get her answer under the gin, tetrax, loaded, and full force. Julia, you're up for burn.
I got Margelli for you. Good. Pounded down the pieces on a high power line. FB lighting came, 6 shots turned into assistance.
Charlotte Hill?
No, curtain 3. We have to hold on for what we can save.
27-year-old male, short of breath, pulse ox 82, increased breath sounds on the
No
right.
facial burn.
Do a thorax.
Okay, set up for chest 2.
Almost blown up below the elbow. Intubated up to 10 MS. All right.
Sam,
Getting a reimplant. 50 pieces.
go.
Burns over 90% of his body. Should have told
I think there's a radio to tell the burn surge. Okay, cool.
Check the signal here. Set up for intubation.
lot of things. You see a great, great variety of things, from the most mundane, meaning boring, the most critically ill, dying people, dying children even. It's very fast paced, as you can tell from those little clips. It's generally resolved, or you've decided on a disposition by the end of your shift and by the end of their stay in the emergency department. It doesn't linger too long. It's really a great combination of medicine and surgical specialty. You use your mind to diagnose, to think through, use your knowledge base and your training, and you also use your hands, do lots of procedures, and I'll show you that. Sometimes we do get to save a life or two, and on occasion we deliver babies. I've done that. We're not on call, so when you're done, you're done. At least with patient care, direct patient care. You go home, they don't call you from the hospital. Dr. So-and-so, can you come in? We do have pretty flexible hours. When I had my children, I took 3 months off each after I had them, so I could be home. And we get paid well. This is just an example of the board, my patient board at work. So you can see there's a 58-year-old with weakness, nausea, vomiting, 56-year-old male with swelling in the arms. Sadly, this 14-year-old who was there with suicidal ideation and alcohol abuse. Testicular pain, abdominal pain, falling, lacerations, chest pain, narcotic abuse, toe pain. So there's a great variety. This is a brain hemorrhage of an elderly patient I had that came in. This one was the young man who was shot in the buttocks with a shotgun. This young man came in with a dislocated jaw, and I reduced him. This is an elderly nursing home patient who fell off her bed, crushed her eye. That eye crushed underneath her. I take your patient with heart attacks. This gentleman came in with a heart attack. This patient, this is a CAT scan of a collapsed lung. This part of it is the extra air in the lung, and this is the lung stuff. This is hard to see, but this is a kid with a fracture, spiral fracture, right through there. And sometimes I do see babies are crying like that. And you can do cool things like reduce the dislocated hip like a box.
Oh, put it down.
So focus here, focus right here.
There, good.
Oops, pardon me.
Awesome, that is cool. That's too cool, right? Pop it.
So that's kind of cool. Procedures, do a lot of procedures, like doing things with the hands. That's one of the reasons I love emergency medicine. Now, why wouldn't you want to be an ER doctor? There's a lot of reasons why you wouldn't want to be. Emergency medicine is a very high stress specialty. Everything is fast, it's critical, it's time sensitive. People are very, very sick, and there's lots of them, lots of patients. 2/3 of my shifts are weekends, nights, and evenings. And so those are primary family times. That means we also work a lot of holidays. I work a lot of Christmases and Thanksgiving. The emergency physicians are confronted with the ugliest and saddest parts of society. You know, I've been in the ER a long, long time. And there's always, you know, patient to stick out. And when you have to tell a mother that their baby is dead, that's very hard. Or you have to tell elderly couple that have been married 65 years and their wife or their husband just passed away. Or they're just lingering and they won't survive. These are hard things. You see patients that are abused, physically, sexually, psychologically abused. that. I don't really think that's a great idea, but I won't stand on that. So college for 4 years, 4 years of medical school, and then you've got to train another 3 to 4 years for emergency medicine specifically. General surgeons who, cut out gallbladder, the appendix, they study for 5 years. Brain surgeons, they study for 7 years after those. My personal educational journey, I went to Stuyvesant High School in New York City, a science math school. I went to Cornell undergraduate school as a biology major. Then I was accepted to medical school in Syracuse for 4 years there in the ice cold Syracuse. It was good because then all you could do is study, right? It's cold. Then 1 year in Providence doing a surgical internship as a brand new graduate. And then right here in Phoenix, I spent 3 years training for my emergency medicine certification and doing my residency there. I see a lot of women here, and I'm a woman, so I want to say a few words to you. This is a little bit special challenges for us. Emergency medicine is really, really great for females. There's a lot of flexibility in the schedule and the hours. Like I said, I took time off when I had my kids. You can go to their events during the day. A lot of times you get stuck with a 9 to 5 job, 8 to 4 job. You really can't go to your kids' stuff. You never have to be on call, and that's a good thing. Once you're home, you're home. It's great camaraderie. We've got lots of women in our specialty. Lots of them. The high income we get, it really does help because you're too busy, too tired, and it helps us kind of do those other things that we would normally be doing. Stressors that are associated with raising your kids, However, I have to put a however in there. It is one of the most stressful specialties. If you did something like ophthalmology or radiology, these are regular hours, relatively speaking. The schedule is irregular. I mean, I don't think I've had the same weekly schedule for 22 years. Every single week it's a different schedule. They work a lot of night shifts, and those are not easy. There is a higher rate of divorce and suicide amongst emergency physicians, and physicians in general, actually, general female population. And I intimated this earlier, you do work a lot of family times and holidays. We miss that a lot. It can be very physically exhausting because of the shift work and the irregular hours, the stressful hours.